with Limbs and Things.
Welcome to Pull Up with Limbs and Things. My name is Dr. Chanel James, and tonight we are pulling up with Dr. Gupta of BlueRock Care. And tonight, as always, we are confirming something you know, challenge something you don't know, and giving you an opportunity to share that information with someone else. So if you're watching us live, you can hashtag live. If you caught this on the replay, you can hashtag replay. If you have any questions or comments, you can put that in the chat, and then we can discuss them. Dr. Gupta, welcome.
Thank you. I'm so happy to be here. Thank you for inviting me.
Absolutely. I am glad that you're here. I have a lot of patients who they get insurance and then the insurance quote says you don't have to have a primary care provider. And then they just decide, you know what, I don't need one. And so I wanted to find someone in the area who had a different approach to primary care. And so if you could tell us a little bit about you and your practice at BlueRock.
Yeah, absolutely. My background is in internal medicine. I grew up in in Northern Virginia and did most of my training in the DMV area. And I've practiced in a lot of different places. I've practiced on the inpatient side as a hospitalist. I've also practiced as an internist. And along the way, I've gotten trained and certified in lifestyle medicine and integrative medicine also, just because I found myself getting asked a lot of questions that I couldn't fully answer. So we definitely incorporate those things into our practice as well. I lead BlueRock Primary Care. We're at Penn Branch Shopping Center, and we take a very full service approach to primary care. So I think we're about as kind of comprehensive as a small primary care practice can get. We're very proactive, and we have a pretty small but really awesome team that's dedicated to helping people hopefully improve their health, as well as prevent worsening of health or prevent decline of health.
Awesome. Okay. And that's one of the main reasons why I reached out, just to see all the different things that you are doing, especially in the DC area. I think we tend to go to the larger hubs and not to people that are necessarily in our community. So glad to have you here. So I have a couple of questions for you, and I want to know if you could give us 3 things that you think an internist would appreciate an older adult knowing or their caregiver so that they will continue to age well.
I think one really important thing to know is just how much is within your control. Mm-hmm. I think in healthcare, most people don't enjoy going to a doctor's office or going to a hospital or going for a radiology test or really anything pertaining to healthcare because we're usually worried about what's going to happen at the appointment. And sometimes it can also be really unpleasant. And it's important to realize that there might actually be a lot within your control when it comes to your health. We know that lifestyle has a huge impact on both short-term health, like how you feel that day in terms of your mood, your energy, your sleep, and other things, but also long-term impact. So we know that by adjusting how we live every day, we can really, really prevent a lot of chronic disease. And, we specialize in senior-focused healthcare. And by the time most of our patients are in their 60s, they usually have 1 or 2 chronic conditions and sometimes many more. So the more proactive a person is, well, the more informed a person can be, the more proactive they can be, which means they're probably going to be better able to care for themselves later. So that's one thing that I wish all people knew.
Mm-hmm. Okay. Anything else?
Yeah. Well, I can dive a little bit deeper into that because when we look at the things that Americans tend to suffer from and Americans tend to even die from, among the top ones, we see heart disease and cancer, heart disease and cancer, type 2 diabetes, Alzheimer's disease. We probably all know a neighbor or a family member or a friend that suffers from at least one of those things.
Right.
And we know that 80% of type 2 diabetes and 80% of heart disease are probably somewhat preventable. And the more we understand about how diet, physical activity, coping with everyday challenges impacts things like even cancer and Alzheimer's disease, the more we realize that some of that might also be preventable. And so I just wish that people were brought up with that message, and people went to school and went to church and were out in the community hearing that message.
Mm-hmm.
I always think it's a little bit sad when somebody hears that for the first time when they're 65, and they find us, for example.
Yeah.
So I just wish we could all keep reinforcing that message, because it's a more positive one than we're hearing these days.
Absolutely. Okay, so you're talking a little bit about the holistic methods, but let's dig a little deeper. What holistic methods can be used, say, for the type 2 diabetes that you mentioned before as being like a leading cause of chronic conditions or leading chronic condition?
Definitely. We try not to let patients with type 2 diabetes leave our office without at least giving a nod to or discussing nutrition in some way.
Mm-hmm.
With type 2 diabetes, nutrition can really have a profound impact. One of my favorite patient stories to tell, actually, is a guy who found us in his 60s. Unfortunately, we told him he had type 2 diabetes, probably after he had it for a while. And in our first visit, I think it became quite clear that he was not going to be very interested in, starting insulin or starting several medications that would be the normal recommendation.
Mm-hmm.
And so, because he was very motivated and very interested in making changes, we were able to take a different approach. He was also special in that he was willing to change his life overnight. And so he changed the way that he ate and drank. He started preparing his own foods. He started walking for a long time every day. And he probably did a few other things, but those are the basic things. And he brought his sugars down. The number we look at there is called a hemoglobin A1C. That looks at your average blood sugars over 3 months. His was in the 11s when we started.
Yeah.
And guidelines suggest starting insulin at that point. And he brought it down to the 6s without medication, with lifestyle changes within 3 months. So that is a very dramatic case, but it also shows what's possible, right? So it doesn't mean that everybody's going to take his journey and everybody's going to be able to do that tomorrow. That's very difficult. But if you know that that's a possibility, what they say shoot for the stars, you might land on the moon, or vice versa. Shoot for the moon, you might land among the stars.
Right. But that's great, because I was going to ask, do you offer the holistic option first? Or, we always think medication is the first line of treatment for disease, but I think it's important what you just said, and the fact that you are determining it based on who you're in front of and seeing their reaction or their preference to the options given.
Yeah. The decision is never going to, even if I wanted it to be, it could never be mine only, right? It has to be a joint decision. Mm-hmm. Do I offer it first? Yeah, I love the way that you said that. It depends who we're talking with. So if it feels like a realistic option and a safe option to pursue, then I think that's the better way to accomplish it. If it is not feasible, or if it's not going to be safe to take just the lifestyle route, I might suggest a hybrid version where we, maybe we do start medication and we also make lifestyle changes. And maybe we connect you with a dietitian or a nutritionist, or maybe you start coming to our group workshops that we have, sometimes on Zoom or sometimes in person. Maybe you use other outside resources. Maybe you come in to see us quite frequently. Mm-hmm. That example that I gave, he was following up frequently. He was in touch. So it's not like, disappeared and we're wondering, oh my gosh, is he okay?
Right.
He left here with a connected
Mhm.
blood glucose monitor. And so every time he checked his blood glucose or stepped on a scale that we gave him, we received that data. So we
Good.
could see that we could monitor the trends and make sure that it was a safe plan.
That's good. Now, I find that a lot of older adults are going to the doctor multiple times throughout the year. And it seems as you get older, you're going to the doctor more frequently. And it doesn't necessarily have to be that they're seeing specialist after specialist, but they're coming to see their primary care doctor possibly more than once a year. Why is that?
We see most of our patients way more than once a year,
Yep.
just because we like to be proactive. I think if you look at most primary care practices, you'll find that the most common reason for a visit is because they have a respiratory infection or because they have back pain or because something is not going right.
Mm-hmm.
We try to see patients when things are going right, because then we can help to implement whatever is missing, right?
Mm-hmm.
That's going to prevent that thing from going wrong. So, I usually suggest that our patients see us 2 to 4 times per year. And if things are not going well, then we see many of our patients much more frequently than that. So it really depends on that on your health. It depends on what kind of the rest of your care team looks like. Like
Yeah.
if you also have to see a nephrologist and a heart specialist and an endocrinologist, coming here 4 times per year might not be realistic. It might also not be necessary.
Yeah.
On the other hand, if you're struggling to keep everyone's messages straight, or if you're hearing conflicting things, or if your medication list is 20 deep, then you might need somebody who can look at the whole picture rather than somebody who just talks to you about one specific illness or one specific set of medications. So I think primary care can be very powerful.
Mm-hmm. So that kind of goes to my next question in terms of people knowing exactly what a primary care doctor does or an internist, because we tend to think, well, I don't have a general question. I have a specific question about my heart, or I have a specific issue with like my back or something. Why would you need a primary care provider? Or what do you do as a primary care provider?
Some people refer to primary care as kind of the quarterback of the healthcare team. I think that's a reasonable way to think about it. Generally, if somebody has a health-related question, I think primary care is a good place to start, even if it's about diabetes that somebody else is managing. Your primary care doc can probably address that question either fully or at least partially. Some people, when they walk into our office or after they've been here a couple of times, they ask us if they're like, "Oh, I thought you were concierge medicine because this looks like a concierge practice."
Right.
But it's really just what I think good primary care is, right? You need to be able to call your primary care office and get in touch with somebody to get your questions answered. If you're sick and you need a visit, you need to be able to get in that day or maybe the next day. And you need somebody to go to ask your questions and get your screenings and get your orders and get your refills and to coordinate all of the care that your specialist might be doing. And that's what we do as primary care.
Gotcha. Okay. All right. So tell us, since you led into it a little bit, what's the main reason why you started BlueRock?
That's a big question. I think I might need another hour or two.
Okay.
But I will try to condense it. I have always, I mentioned that I spent time learning about other things that aren't as mainstream in primary care. And I was able to create, for example, a prior practice up in New York City that incorporated some of those approaches. But I've always felt like it belongs in primary care. And so I've kind of always known along the way that at some point I'd make my way back to primary care when when things were ready and when I was ready.
Mm-hmm.
And we started BlueRock because we thought that we could do primary care exceptionally. And that's what we've focused on for the last 4 years. And that's it. Primary care is kind of in a way, it's a field that's losing its soul almost. People are flying out of the field left and right.
Mm-hmm.
We've lost primary care clinicians each year since 2020. And I hope that doesn't continue, because if it does continue, then a few years from now, people might find that they're not able to have a reliable primary care practitioner, which I think would be unfortunate. So
Absolutely. That's happening in physical therapy as well. I don't know if it's the pandemic's fault or just people trying to pivot and do something that's less taxing. But it is sad, definitely. Okay.
right.
I want to know, what's the BlueRock difference? Tell me all the things that BlueRock does that would make it so that an older adult says, yes, I really need to try to get to BlueRock.
I think one of the major things that makes us different is we try to take a fun and more friendly approach to it, which I think is so critical in any type of healthcare, because it can be very unfriendly. It can be very sterile, and it can be very uninviting. And despite the white wall behind me, if you were to walk through the rest of our practice, I think you would see that. I think you would see that you probably get a few warm greetings from different team members, and our team is the most awesome thing about BlueRock. But our practice is also set up. Sorry, I missed that. What did you say?
I can vouch for that. I agree. Everyone was very friendly.
Yeah, and we're also physically set up in a way that promotes getting to know each other. Like you're not spending your visit sitting on an exam table without clothing on in a gown, waiting for an hour and then talking for 10 minutes and then leaving, right? That's just not what a visit here looks like.
Right.
It's more like you might wait for a couple of minutes. We're sitting at a table across from each other during the first visit and during most of all of the other visits as well. You're treated with a lot of, I hope, dignity and respect. I hope that our patients echo that. I think that they do. And then we try to help you, get you on your way with clear instructions and a message of how to get in touch with us if you need us sooner than when we next planned. So it's just meant to be more intuitive and more accessible. When you need us, we're there.
Agreed. Okay, now you didn't say the other things that I found helpful, especially for an older adult. When you come into the Penn Branch area, depending on which location parking lot you go to, it's free parking. And then it's accessible so that you can get right to the door. You don't have to really have someone drop you off because it's so far from the parking garage or something like that. Or the fact that when you come up the elevator, you're right there. The person doesn't necessarily have to walk very far. And then if they do need labs done, they can get them done in office. You didn't say that part.
Thank you. Those things are all true and will stay true. We also do other basic diagnostics in the office when needed. So EKGs, spirometry testing, several others. If you have asthma or COPD and you desperately need a nebulizer treatment, we do those things as well. So many of the things you would find in urgent care. And in fact, I ask our seniors to think of us as their urgent care. I'm always like, call us first if you need something, assuming you don't need to go to 911 and go to the ER.
Right. And then you didn't say the other part, that you guys make house calls, depending on
Yes, you're right. So we do sometimes, we do home-based primary care as well, locally. And so if the need is there, we take care of you where you need to be taken care of, because things change, right? You might be fine one day and then maybe you have a surgery that makes you less mobile for the next couple of months and you can't get into the office as easily. That doesn't mean you need us less. That means you just can't get to us quite as easily. So maybe that means we make a house call while you're waiting to get back on your feet. and get back into the office. So that's, yes, we kind of specialize in primary care across the spectrum of ability.
Mm-hmm. And that's important because I find that a lot of aging adults, they either have to coordinate transportation, going to multiple locations because labs have been ordered, having to figure out, okay, can I get there? How long do I have to wait, especially if they're on Metro Access and all of those different factors that we don't necessarily consider. It seems like Blue Rock has kind of considered those
Thank you.
things. Mm-hmm. Okay. So, what's the most common condition you treat that you wish you did not?
That we wished we did not.
Mm-hmm.
I don't know how to answer that question. That we wish we did not.
Mm-hmm. Like if people knew about it, like you were talking about with your lifestyle changes, they probably wouldn't have this disease. You wouldn't have to treat it.
I mean, it would be lovely to see a day when preventable disease is declining, right? We see it increasing, right? It's increasing amongst older adults. It's increasing amongst our children, which is heartbreaking. So it would be wonderful if we could see that go down. We do see it go down on an individual basis, right? So somebody who has really uncontrolled diabetes, who then makes changes, whether it's through medications or lifestyle or both, might need us less. Like the next year, instead of seeing us 5 times, maybe they'll see us 2 or 3 or 4 times. I can't say we wish we didn't treat those things, though, because I'd rather them come here than not go anywhere or go somewhere where they might not be as comfortable.
Got it. Okay. All right. Let's see. What is a holistic option for managing like blood pressure issues, whether it's low or high?
Lifestyle will always be a part of that. We see that. We also see that if there's a weight issue and somebody is at a higher weight than is healthy for them as a person, that sometimes blood pressure increases with weight, and sometimes if weight also comes down in a healthy way, then sometimes blood pressure also improves in a healthy way, and sometimes we can peel off medications. Sometimes people also have high blood pressure that's provoked by a lot of like an anxiety reaction or a stress reaction. And so if we notice that that's happening, then addressing those underlying stressors or helping to direct someone to learn ways to cope with those everyday stressors could become an important part of the treatment plan. The DASH diet, which is very rich in veggies and antioxidant-rich foods and lower in processed foods and foods that are high in saturated fats and all the things that we know not to have a ton of. Right. That can be helpful in lowering blood pressure a few points. Hibiscus tea without sugar can be helpful in decreasing blood pressure a few points. So it's usually a combination of approaches, plus or minus medications that we use to help bring down blood pressure.
Good to know. So if someone was to ask you, like they've been on medication for a while and they're trying to find a physician that would help them to wean themselves away from that and transition to a holistic option, would you be the best person for that?
I'd love to have the conversation. I'll say that. I think I always try to be honest and realistic also. Yeah. So I like to partner with people, and I do my part. You do your part. I will answer all of your questions, and I'll let you know if I think we're going down an unsafe path. I'll also be very upfront about that, because I don't want to mislead people into thinking that, okay, today I'm taking 10 medications that are controlling my blood pressure from being 200 over 120, and I'm taking another several medications that stop my blood sugar from being 400 and now they're 200. There's probably a slower and safer way to get somebody weaned down off medications. than, for example, stopping them overnight.
Got it.
So,
Okay.
it's kind of a trust thing, right? So we have to work
Absolutely.
together, and that's where I see the most success.
Got it. Okay. When you tell us that you're working with older adults, are there specific pains that are specific to aging and then those that are not? So, what are those pains that are associated with age or with aging?
Pain, you're saying, like PAIN, right? Like actual pain.
Yeah.
Yeah, I mean, we definitely see risk for things increase as we age. So we see, the more we use our joints, like the more wear and tear there is, the more common osteoarthritis becomes. And one of the most common complaints that we hear are going to be associated with degenerating joints. So that could be knee pain because we use our knees every day if we're walking around. It could be lower back pain from degenerative disease in the spine. I think osteoarthritis related pains are probably the most frequent one that we see. And physical therapy can be an incredibly helpful tool for that, because if you strengthen the muscles around those joints, that can help to offload it without going to surgery or something more dramatic, or even after surgery.
That's true. Okay. I know we talked about BlueRock. Let's talk about any one last final thought you have for the person who's trying to consider BlueRock as the best place for them.
I guess I would just, I think the relationship with the primary care practice can be an incredibly powerful one. It can be very therapeutic if you trust each other, if you can get there, if you want to get there, if you want to have a healthcare person in your corner. I think primary care is very important. Primary care somewhere. And if you're looking for primary care, I'd say just come check us out, right? You can come in and stop by our office to say hello, to see our team, to schedule an appointment if you want, or you can call our office and ask questions. Our team is truly fantastic, and we'll do our best to answer your questions. We also have a website. You can check us out at www.bluerock.care. And that has some information about us. It also has a way for you to contact us on the website. So really, we're here for you to answer your questions if we can.
Wonderful. Okay. And then BlueRock accepts what insurances?
We accept most insurances that most area seniors have. So, we kind of specialize with Medicare. We also accept Medicare Advantage plans, including United. We see Cigna, Aetna, Blue Cross Blue Shield. We take care of patients with most insurances.
Okay.
It's usually not an issue for area seniors.
Okay. That's good to know. Well, I thank you so much for joining me tonight and talking a little bit about BlueRock, as well as some of the things that we find in the aging adult. Is there anything that you want to leave us with that maybe you didn't say, but that you want to reiterate that's important for an older adult to know as they get older about their primary care needs?
Maybe I'll leave you with the concept of the blue zones.
Okay.
The blue zones was a concept put forward by a researcher named Dan Butner.
Okay.
He was a National Geographic fellow, and he was interested in looking at communities where people were aging well, right? They were living very long, but they were also living very well. Like you were seeing centenarians, you were seeing people who are 100 plus that are active and independent, and that wasn't as rare as it is in most communities, including most communities that we work and live in. Right. And so he found 5 areas around the world that he called the blue zones. And what he described in his research was that, those communities shared They shared several things, but among them were they ate a diet that was really rich in vegetables, fruits, whole grains, and limits processed foods and saturated fats and red meats and things like that. He found that those communities and the individuals that lived there tended to incorporate physical activity in day-to-day life.
Mm-hmm.
That was often in natural ways, like they had to walk up a long hill and walk 20 minutes to get to the grocery store and then walk back. And they did that. They did that to go to the grocery store, and they did that to go to church, and they did that to go to school to pick up the grandkids.
Yeah.
It was just incorporated into everyday life.
Mm-hmm.
He found that there was a strong sense of community. I think it was very often a spiritual community.
Mm-hmm.
And I find that exists in our neighborhoods. That's a wonderful opportunity.
Mm-hmm.
But it doesn't have to be a spiritual community. It could
Right.
be a different type as well. And they also tended to have a positive outlook, or feel like they had the skills to deal with everyday challenges. And I think that's a good place to start thinking if you're thinking about making a change. Is maybe think about those 4 things and consider, hey, I think I could actually make a difference in that one. And maybe that's the place to start.
Mm-hmm.
And then talk to somebody that you think might be able to help you work on that. Because when I ask my patients what they want to do, I do hear many people say, like, yes, I want to live long, but almost everyone says something like, I want to live well. They want to maintain independence. They want to be self-sustaining or self-sufficient, right? Everyone wants to live well.
Right. Well, those are good points. I like that. That's highly important. I think the community itself, like reaching out and touching somebody, that has been a challenge for people, like bouncing back from COVID, especially the older adult population that's a little more timid to come out and join certain groupings just because they don't want to put themselves in a vulnerable situation. But those are very good. I thank you so much for your time tonight.
Thank you. I've really enjoyed the conversation. Thanks for having me.
Absolutely. So if you are wanting to connect with BlueRock Primary Care, the number is 202-796-9775 or bluerock.care. Is that right, Dr. Gupta?
Yes.
Okay. And if you are in need of physical therapy, you can always contact LimbsNThings at LimbsNThings.com or 202-643-2636. Thank you, everybody. Have a great evening.